Everyone, we're going to give everyone just a couple of minutes to join us. There are people pouring in to the chat rooms here, so we're going to just give it a second.
Awesome. Well, happy Friday, everybody.
I know, right? Look at all these people coming. This is so great. It's a party. It's a party on a Friday. What more could you want? Metabolic health party. Well, welcome everyone. Just give everyone a couple of minutes to join. We talked about doing dramatic poses while we wait.
Yeah.
All right. Well, let's get started. Hi, everyone. Happy Friday. Like we just said, my name is Dr. Patti Devers, and I'm the Chief Clinical Officer here at Genova Diagnostics. And we are honored to have co-sponsored this event with the Metabolic Health Summit with these amazing speakers and panelists. And we're so glad that everyone could join us again for a follow-up live Q&A as it relates to the metabolic health revolution. So thank you everyone for attending. I just want to thank our amazing speakers, the inimitable Dr. Dom D'Agostino, the beautiful Dr. Allison Hall, the stunning Victoria Fields, and our very own Dr. Michael Chapman. So thank you all for your expertise. Thank you all for being here. There are hundreds of people in this chat, so I'm going to do my best to curate all of these questions. This is their opportunity to interact with world-class speakers. And so everyone watched these lectures with rapt attention, and I bet we're taking mental notes, written notes of things they wanted to know to dive a little bit deeper. So I'm going to do my best to curate this chat the best I can. And clearly, we're not going to get to every question, but I'm going to do my best to at least curate the overall themes and see if we can cover some of the recurrent questions that are coming up. We actually even had several that were emailed prior to this Q&A event, so I'm going to try to include those as well. And just from my own personal experience, I can tell you that I had a lot of aha moments during the metabolic health revolution, and probably believe the biggest one is that I appear to be the only cool person not eating sardines. I mean, it was a sardine heavy conversation, and I'm going to try to up my omega-3 game. Let's just start right there. But let's jump into some of the big questions that are coming in. Okay, the first question I'm going to send to Dom. So let's talk a little bit about exogenous ketones. And you mentioned in your slides ketone esters and ketone salts. If someone is in dietary ketosis, why or when would they take further exogenous ketones? And then conversely, if you're on the standard American diet and you take ketone esters or ketone salt, does that convey any type of metabolic health benefit at all?
Yeah, these are great questions. If you are on a well-formulated clinical ketogenic diet, meaning a 4-to-1 ratio to a 1.5-to-1 ratio. So we do the ketogenic diet in grams, and that would be close to 90 to 60% fat. So eating that amount of fat with adequate or moderate protein and nearly zero carbohydrates will produce a state of nutritional ketosis, which is very difficult to do even in a clinical setting. So exogenous ketones in the form of ketone esters or ketone electrolyte salts is a way to further elevate or augment our body's ketosis. So when we consume ketones, that can provide fuel for the brain, and ketones are signaling molecules, anti-inflammatory molecules, so they have additional benefits. So a lot of research is being done. You can go to PubMed, and there's hundreds of articles, and there's over 100 clinical trials right now on clinicaltrials.gov. So it depends on the person. Now, if someone's on a standard diet, a lot of what we've done in the research lab is actually administering these agents in rodent models or human subjects too, or we're doing research on that end, and giving exogenous ketones to circumvent the dietary restriction associated with being in ketosis. Many people who go on a very high-fat diet have an elevation of ApoB, LDL, sometimes their other biomarkers do not change favorably. So exogenous ketones could be a way to elevate ketones, beta-hydroxybutyrate, and we know that this molecule has a wide range of health benefits. So it's currently being studied. You know, we do need more human randomized clinical trials to study this, but you know, we've been studying it for over a decade now, and we think there's potential human applications. A lowering of blood glucose is always observed, so that can be beneficial. The appetite suppression effect, and then we're doing metabolomics too, you know, to further do, and very interested to work with you on that front too.
Excellent, excellent. Well, I love that. There's a lot of conversation about Michael's N of 1 metabolic experiments, being your own metabolic detective. I mean, the data was compelling, and we watched you every day through all of this, and we watched your body change. We saw your metrics change. The biometrics were phenomenal. But within the panel discussion that you all had at the end of this metabolic health revolution, Allison brought up a point that I thought was important, and we talk about different levers we can pull as it relates to metabolic health, and she talked about sleep. And so I think what I want to ask you as it relates to being your own metabolic detective, how did, not only we know about your biometrics, what happened with your sleep and your mood and your cravings, and taking that a bit deeper, what are other lifestyle metrics that changed for you?
This is fun. This is like being on a game show. I feel like there should be a timer in the background. The other metrics, everything's connected, right? And I think one of the things that we always notice with any sort of disease process or recovery process, health process, is that because you start moving in the opposite direction of disease processes, everything starts to kind of migrate a lot of times in a more beneficial process. And so with respect to sleep, I would say, whereas I commonly, as you know, Patti, not a morning person at all. I tend to arrive whenever I can essentially get here. And that completely changed within probably a matter of weeks, where all of a sudden I was like waking up with energy, ready to go, and, you know, kind of excited to start the day, which is not even something I experienced as a child. So, you know, all of those connections, I noticed that from a sleep perspective, an overall energy perspective, a mood perspective, you know, and it's hard to know how much of that had to do with the metabolism, how much of that had to do with the exercise. We know those things are intrinsically connected both to mood. And so to me, I think as an intervention, it's such a powerful tool, because not only that energy boost helped me to do the lifestyle changes like the exercise, which in a lot of people is a barrier. So the more that something like this can get somebody moving more or started, or provide them just a little bit of palliative support, then it helps them make those tough changes that maybe they're not even used to, like this person.
And I think it reiterates that one positive behavior change leads to so many others. And if, say you have a hard time making those nutritional changes first, and you want to tackle sleep first, then if you get better sleep, you're going to make better food choices. It's going to interplay with hunger hormones, right? Our insulin resistance and so forth. So if that's your angle, start with that. Or if you're like, I'm not ready for food, I'd rather focus on the exercise. Once again, then you'll start getting better sleep, right? It's going to enhance dopamine and norepinephrine, and then we start moving towards the food. But I think sometimes people feel like, I have to change everything and I have to change it overnight. No, start with one behavior change. And the key is to be intentional and self-aware during those behavior changes. Start looking and being curious for what's getting better, and then that will lead to another good decision and another good decision and so forth. So,
right.
Snowball
Right.
effect.
Yeah, absolutely.
That makes me think of your 4 tenets of health, Michael, as your naturopathic practice.
I mean, I think one of the things too, it comes back to purpose, right? And any of these behavior changes can be so difficult, and you have to have the energy to do so, and you have to have the motivation to do so. And even if something like exogenous ketones is going to give you that little bit of spark, or maybe it's just something with respect to a new hobby that you're having, or something like that, that gives you that little bit of momentum that you can then, as Allison said, it's just a feed forward cycle. Once you get one thing going, then you start to see the benefit of everything else as it comes together.
Perfect. I love that. All right, we have a lot of questions. How do we get the Metabolomics Plus profile? Just quickly, if you're in the continental United States and you're a consumer, you can go to connect.gdx.net and order it there, except if you live in New York, New Jersey, and Rhode Island. feel free to write to your congressman. If you have a doctor, they can sign up to get a Genova account and they can order it for you. You can definitely get this in the UK. There are questions coming in there, but you'll need to go through a Genova account. We do have a Find a Doc tool on all of our websites that can connect you with a Genova client somewhere in your area. So just putting that out there. Other questions. This one's for Allison, which is great. So we know metabolic syndrome and obesity, the incidence is rising, and even more so in pediatrics. So as the metabolic health specialist and a pediatrician, you're in this unique position to kind of head this off at the pass. And, you know, throughout your presentation, we talked about some of those conventional markers. We talked about lipidology 101. And so I think the question for you is, how aggressive are you, or how aggressive should we all be as it relates to working children up for any type of metabolic health? And where do you start? And when do you start?
Yeah, so I do think right now the guidelines are really based on BMI, if that child is obese, or if there's a family history of specifically more so like hyperlipidemia and diabetes. But it really starts with the conversation that you have with the patient and the family. What are the health habits in the household? Because I'll have kids who have a quote healthy BMI, but they're eating horribly. So it starts with that what's the history taking? What's the food like at home? That's a great time to explain. And I always try with my pediatric patients, you know, I'm counseling parents, but I'm also counseling the children. And I want to arm the kids too with understanding why it is we should eat foods that we grow, hunt, and fish. And I try to simplify it as, you know, okay, so when we want to eat foods we grow, hunt, and fish, can you grow a Pop-Tart? Can you grow an almond? Okay, I can grow an almond, so I get that, like, that methodology there. So I think it really starts with history taking, of course, then evaluating your patients. And if they, number one, do have an elevated BMI and there's a family history, then I definitely, I do utilize labs. And I do that because I feel like sometimes the BMI is not enough. And it's also, it's a hard subject matter when you're talking with parents about their kids, and you don't want them to feel shameful or that they're doing something wrong. But if I have concrete labs and I see that this fasting insulin level is sitting at 15 for a 10-year-old, that's a red flag, right? And I actually do fatty liver ultrasounds on my pediatric patients when they have an elevated BMI, and when they see a diagnosis of fatty liver in a child, that motivates parents. So it's unique to the individual, but if they meet certain criteria, I absolutely do so. And I do find it to be an extraordinarily powerful tool to get a parent's attention to then modify changes within the home, because it really does have to be the entire family making the changes. I hope I answered that question.
You did. That was awesome. And again, I think a lot of the conventional biomarkers are phlebotomy, which people shy away from in children. Metabolic, or the Metabolomics Plus might be a good option because it's non-invasive and, you know, just
right.
a personal report. So just something to put out there. All right, some great questions. Victoria, you know, your panel discussion was great because it gave us this perspective of a consumer who's just opening up this kit, performing the test, sending it back, you know, kind of the lay of the land of how that works. And then you get this report. And I think we can all agree you're not a typical consumer because you're a wicked smart biohacker, biochemistry genius. So not very the typical. That being said.
Anytime you want to come on board, you're absolutely welcome.
Michael and I were like,
that's so nice. You guys
that being said, right. A lot of the consumers won't have Michael Chapman in their back pocket and won't have the Victoria Fields genius. But number one, just at face value at the report you received, do you think there was enough actionable information? And then number two, what are your go-to resources to become so wicked smart? Like, you know, where do you go to learn some of these things?
Yeah, say the first question again. It was it enough?
Getting it at face value, was there enough actionable information for you?
Oh yeah, I thought I was so impressed by that part of it. And I mentioned this to Michael when we had a separate call kind of diving into everything together, which was really great. But seeing sort of, you got kind of have this like dashboard initial page that basically breaks down everything from oxidative stress to mitochondrial damage, toxin exposure, all of these great categories with numbers associated, and based on those numbers, you know, whether it's yellow, green, red, you kind of know where you're at and if you need some maybe additional love in that area. And then once you dive a little bit further and kind of get into, okay, what markers specifically are a little wonky, that then you guys give this great educational piece of like, here are some foods you can maybe eat to bump up folate, or here, you know, is XYZ to reduce this. And I really thought that was so helpful, especially in something that, you know, a patient can just order themselves, where they have this little snapshot of education. And it doesn't just really stop there. You guys also have a great resource center as well. I think, Patti, you put this crazy document together that further breaks down all of the research behind all of these biomarkers. If you kind of want to nerd out a little bit more, I thought that was great because it's all well referenced, which is so important. And yeah, it's just a very comprehensive sort of multi-page results report that you really don't typically get when you do other kind of lab testing. It's like this whole educational piece, which at Metabolic Health Summit, obviously we're major fans of educating not just the, you know, medical professional side, but the lay public too, to become empowered and take action and understand why they might want to do that. So that amazing job on that front with the test itself. I thought it was great. In terms of where I go for resources, it's funny, I've had, you know, I've been lucky enough to, in my career, to work in nutrition and fitness for many, many years, coaching athletes for a long time, and then got actually into working with cancer patients. And that's how Dom and I and Angela all connected, and Metabolic Health Summit kind of came to be. A lot of what they were doing in the lab was what we used with a nonprofit to work with cancer patients and actually canines with cancer. And through that process, I got to start to connect with incredible minds in the field that were doing research. So obviously, like, trying to keep my finger on the pulse of all of those wonderful friends and people in the space that are doing this work in the lab, but then also like Dr. Allison Hull, keeping in touch with wonderful people like her, who's actually working with patients in the field as well. But there are also a lot of really great resources and tools out there online for people who want to maybe learn a little bit more about the ketogenic diet. You know, they've been there since the beginning. The Charlie Foundation is a wonderful place for people who are interested more so in using the ketogenic diet as a metabolic therapy for epilepsy. But they just have great foundational resources as well that sort of explain what the diet sort of is. And we really try to, because I think one of the biggest difficulties with learning about the latest science in metabolic health is there's so many different things floating around on the internet that it really becomes hard to decipher what is true, what's not, where do I get my information from? And that's really kind of because I sort of didn't have that one-stop shop resource to begin with. We really wanted to create that through Metabolic Health Initiative, Metabolic Health Summit, hence the conference. We're actually building a whole education platform right now where you can get all of that sort of cutting edge information, not just the very latest on the research front, but also the clinical application side, which is so critical. And then for physicians, offering CMEs for that kind of information, but keeping it open to the public has been so important to us to include both sides of this community to really educate in a way that's evidence-based and hopefully going to move the needle. So I hope that kind of answers your questions. It's kind of been a hodgepodge of collection for me of resources over the years, and then actually working with cancer patients and learning as I go. And then, of course, collaborating with amazing minds in the field. But we're working on building something that people will have a one-stop shop, whether you're a medical professional or person just wanting to optimize their health.
I love it. And Michael and I've been to the Metabolic Health Summit, and it's phenomenal. Great information. Also want to plug the Metabolic Link podcast, which is the Metabolic Health Summit's podcast, as well as the lab report. Let's just plug that one as well. And that's workout is hyperlinked at the end of every report that Victoria was talking about. But since you brought it up, there are some questions in the chat as it relates to cancer diagnoses. So maybe Victoria and Dom can kind of hit some of these. There are patients with cancer diagnoses having a difficult time following the ketogenic diet, being knocked out of ketosis because of chemo. So they're talking about what are the shortcomings and the challenges as it relates to ketosis in cancer patients. And, you know, just as a side note, we always think about that Warburg effect as it relates to, you know, starving cancers, pulling sugars back. So what's your experience as it relates to helping cancer patients undergoing chemo stay in ketosis?
Yeah, that's a really good question. John, you want to speak to this, the research side of things?
Yeah, well, I would recommend that the patient work with an oncologist who's open-minded and has an appreciation for the role of nutrition, not only in the nutritional status of the patient, but in the ability of a nutritional intervention, the ketogenic diet, or just a low-carb diet, to influence metabolic physiology, which really targets the Warburg effect, which is a major driver for cancer growth and proliferation. So our wheelhouse in the basic science research really started out with brain cancer, and brain cancer causes seizures. So it made sense to use a ketogenic therapy to, if not for anything else, to manage the seizures. But as we moved along and found Dr. Thomas Seyfried's research, there was compelling evidence, and this is prior to any clinical trials really being in process, and now there's at least a dozen or more, maybe 24 clinical trials using the ketogenic diet as a means to further augment the therapeutic effects of standard of care. That could be chemo, it could be radiation, or it could be immune-based therapies, so even checkpoint inhibitors. So we do know, and now the metabolic oncology, if that's a term being used, field is appreciating and recognizing that dietary interventions hit a wide range of signaling cascades that are aggressively being targeted by the pharmaceutical companies. PI3 kinase, insulin signaling. It doesn't just lower glucose and starve the cancer of glucose. That's what people thought. Lowering glucose is important, but it's more of a biomarker. Really, the suppression of insulin and insulin-associated signaling is what I think is the most important aspect of a ketogenic therapy. And there could be some cancers where the ketogenic diet could be a contraindication. For example, like liver cancer or certain cancers with the BRAF V600 mutation that could potentially use, certain fatty acids and ketones for fuel. So I think you really need to be up on the literature, working with an oncologist, probably most importantly, working with a nutrition expert, ideally a registered dietitian who is not only trained conventionally, but has an appreciation and a track record for assisting patients on a ketogenic therapy.
Yeah, it can be very, very challenging. Obviously, when you initially, just in working with patients, so I worked with patients through a nonprofit organization called Exogenous Foundation, where we first actually started working with canines with cancer that were otherwise going to be euthanized, put them on a ketogenic diet, got an incredible amount of wonderful information and data through that experience, and then started to build partnerships with oncologists to start implementing this into a variety of cancer patients, from late stage brain cancer patients to early stage breast cancer. And through that experience, and I just want to say I'm not a doctor, obviously, like this is not medical advice, but through that experience, it's so challenging, like just as a baseline, to kind of give yourself a little bit of grace, because many of these people, their life is flipped upside down. Maybe they have a seizure 2 days later, or even 24 hours later, find out they have glioblastoma, right? And their whole world is shifted upside down. And you go from something like a cancer diagnosis to then learning like, oh, a lifestyle change might help. And thinking about, completely overhauling your lifestyle on top of dealing with a life-altering cancer diagnosis can be really challenging, really stressful. And there's a whole sort of grieving process through that too, that just that stress can elevate blood glucose levels and cause a massive physiological shift. So keeping that kind of in mind and giving yourself some time to acclimate and take it step by step. So there are many dietitians out there who will start maybe on a very, very high, or they'll fast patients to start and then get them on a 4-to-1, 3-to-1, what have you. What we found is trying to make it a little bit more sustainable in the process for patients, sort of, maybe something more along the lines of like a 2-to-1 ratio ketogenic diet, between anywhere from 70 to 80% fat, not maybe as high as quite 90%. Many of the patients that we worked with would get similar numbers that you might see on a higher ratio ketogenic diet, but be more comfortable, feel more included within the family environment, because that can be very isolating when you're on this dramatic, a metabolic therapy, essentially using food as medicine. And so that was one thing. But then you know, also, as Dom mentioned, working with somebody who really knows the ins and outs of, you know, using ketogenic therapy specifically within oncology. There are a lot of great dietitians. Actually, we're trying to pull together some resources for people of dietitians specifically who can work with cancer patients, because it is something that's relatively new, and not every oncology dietitian quite yet is sort of on board with that. And as Dom mentioned, there are some cancer types that you do need to keep in mind that it may not be for everybody. But working with somebody who's well trained, an open-minded oncologist, as Dom mentioned, having like a solid support team, and being a proactive member of that process and trying to learn as you go can be really empowering for people in the process, I think, too. So it's a very challenging thing. And also, you know, one exciting tool that we've kind of just talked about are exogenous ketones and where they might fit within the equation when it comes to something like a cancer diagnosis, or something like, you know, Alzheimer's or MCI, where maybe a patient can't really fully implement a ketogenic diet because it's really challenging to do when you're dealing with some of these life-threatening diagnoses. So, you know, that's where maybe something like supplementation could be a great tool in the toolbox. To, you know, help ketones stay elevated and maybe lower blood glucose. The other thing to keep in mind is that, as that person mentioned with the question, many, you know, chemotherapy puts some stress on the body. Of course, that's going to shift some of your numbers. You know, steroids can raise blood glucose. So there's a variety of factors to kind of keep in mind. And again, give yourself a little bit of grace and just take it one step at a time. And in addition to diet, focusing on some of those key pieces that Allison's so eloquently brought up through her presentation and here, you know, sleep, stress reduction, getting sunlight first thing in the morning. There's so many things that you can do to where maybe you take a little bit of the pressure off nutrition and give yourself some balance. And that may also help reduce stress levels. And you may see your blood glucose fall into that great range. So my approach was really trying to, it's funny, I went from training elite athletes to working with cancer patients, but use some of the tools in working with athletes and working with patients and really making it something fun for patients to be a part of and try to empower them to, you know, in the process. So that's a little bit of my 2 cents.
I want to jump on one comment Dom made about, you know, incorporating, or at least informing your oncologist that you're going to be doing this. I will tell you, on my side of the fence, I have a lot of patients who have a cancer diagnosis. They want to attempt a ketogenic diet, but the oncologist, they're afraid to even communicate with the oncologist about it. So it's really important that you let the oncologist know. And if they're not on board or just ignorant about it, guess what? Now you're going to push them. And if enough patients push them, they're going to start learning about it. And it actually might help them become more educated in the realm. So please don't be afraid to talk to your oncologist about it, whether they're going to be supportive or not. You must let them know, because it may affect the treatment modality and dosing and so forth, but it also might encourage them to learn more about it themselves.
I love that.
I was going to, yeah, really talk about that too. Yeah, that was great to add that. And if there's one biomarker that I think could be the most important biomarker that could impact the growth of a tumor proliferation, is the glucose ketone index, if you want to call that a single biomarker of the glucose over ketones. And the Keto Mojo device, and, you know, any device that can measure glucose and ketones, you can get that number. And generally speaking, the basic science research and the human research, the emerging data indicate that a glucose ketone index of like 1 to 2 or even 1 to 4 would be a big hit to reducing cancer growth and proliferation for many cancer types, especially those that are really intense on an FDG PET scan, indicative of the cancer using a high amount of glucose, or indicative of a Warburg phenotype, you could say.
I love that. I greatly appreciate that whole discussion, because there are several questions here in the chat regarding cancer. So I think we've hit a lot of them, which is great. So thank you so much for that. I'm going to kick this to Michael, who is probably the smartest guy I know as it relates to mitochondrial dysfunction. There's a question: what are the top 3 things you would do in order to make the biggest impact on improving mitochondrial dysfunction? I mean, you speak to clinicians all day long, Michael, and you treat patients. So how would you answer that question?
Well, okay. This is a game show one. This is great. So I think the things that contribute to mitochondrial dysfunction are the things that we think about kind of as those big systemic issues. So inflammation is going to be a big one. Inflammatory processes in the body, and a huge one of those is the one we've been talking about, which is metabolic imbalance, metabolic dysfunction, and high levels of insulin are going to generate inflammatory processes in the same way that they generate free radicals and free radical damage. And those two things are kind of they're tethered together. We think of actually the entire aging process, they're referring to it as sort of this inflammation process, which is the combination of mitochondrial dysfunction, metabolic dysfunction, and inflammation. And so I think those are biggies as far as limiting free radical risk, and that can be in the form of exogenous exposure through toxins in our environment or what we're taking in. That's going to limit free radical damage, and then endogenous free radical production just based on the processes. So that endogenous production of free radicals is kind of twofold, and nutrition is at the core of it, right? So we need to have adequate antioxidant support depending on what our overall free radical production is. And so if we're doing a lot of strenuous exercise or we're doing a lot of different things, then we're going to need to balance that with adequate nutrition. And adequate nutrition is kind of at the forefront of a lot of these metabolic disease processes. So I think to sum that up and wrap it up from my perspective, limiting free radical exposure just internally and externally, and then having adequate nutritional support, and that's going to also play a big role in reducing inflammation at the end of the day. And so if we have those things going on, and then we have obviously a good balance of our metabolism, then that's going to be a huge thing to not only reduce mitochondrial dysfunction, hopefully stimulate mitochondrial genesis. And then there's those other things that we can do from an intervention standpoint, like cold immersion therapies and things of that nature that can be somewhat stimulating to mitochondrial genesis. But I think from a naturopathic point of view, always trying to correct the cause of the dysfunction first and foremost is going to be how to do some long-standing good work.
Excellent. Thanks, Michael. Chapman. There's a question as it relates specifically to women, as it relates to long-term intake of exogenous ketones. Does that then switch off any production of endogenous production? Is there anything to back that up?
Good question. No, unless the ketones are elevating insulin. So your ketone production is directly inversely related to your level of insulin. And if acute ingestion of exogenous ketones elevates insulin, then that will quickly actually shut down ketosis. For example, if I consume a large dose of a ketone monoester, a beta-hydroxybutyrate, my ketone levels spike up, and within about an hour to 2 hours are quite high, but within an hour. And within 2 hours to 3 hours, the ketones are back down to normal or actually below. If I go into it fasted, my ketones could shoot up to 3 or 4 millimolar, and then 2 or 3 hours later, they're back down to under 0.5. And because it released insulin, I would be hypoketotic and hypoglycemic, which gives me a headache. So the ketone salts or ketone electrolyte formulations with sodium, potassium, magnesium bound to beta-hydroxybutyrate are kind of self-limiting. And when I measure insulin in response to even the largest dose, there seems to be no elevation of insulin. So, and if I go into it fasted, the ketones go up and go back down hours later, but the endogenous production is unaltered. So I think it's a dose response thing. I do not think that consuming large amounts of ketones are really beneficial for the average person. I mean, I do it on a daily basis. We do lose a lot of electrolytes on a ketogenic diet, so I trend towards the ketone electrolytes because you're giving your body sodium, potassium, magnesium, which tend to be depleted. And then the extra boost in energy because they can freely cross membranes and stimulate mitochondrial energy production. But yeah, what you really want to do is titrate the dose such that, and look at your glucose and ketone levels will predict that, right? So I've done a lot of experiments measuring insulin and have not seen an insulin elevation with ketone salts or ketone electrolyte salts, but you will have an elevation of insulin with a larger dose of a ketone ester, which I think is kind of more in the realm of a medical exogenous ketone. And there's lots of applications, but probably not for the everyday use.
Excellent, excellent. That's a great question too. I think this one goes to Allison Hull, since I was struck by your Lipidology 101 piece of your lecture, and sounds as if this person was too. You talked a little bit about, switching into ketosis may actually elevate your LDL, but if all of the other parameters are actually getting better, should we be focused there? This question talks just about that, like why the hard-handed focus on the LDL and ApoB versus the inflammation, and is it possible that some may not be at risk with that higher LDL as long as all of the other parameters are low? So can you speak to that?
Yeah, so as I mentioned, I mean, we're looking at the net effect. And if we're reducing all of these other biomarkers that contribute to cardiovascular disease, then the overall net effect may be worth that bump in ApoB, LDL. But I also do think it's important to understand that when you look at the evidence for cardiovascular disease, ApoB is a player in there. There might be an indication where somebody wants to adopt a ketogenic or carbohydrate restrictive diet to improve multiple biomarkers, but then if their ApoB increases to a certain level, it might be worth considering treating that, despite having the changes made in the nutrition, optimizing glucose control, reducing uric acid level, mitigating insulin. So this is where you can't look at things in silos, and you have to look at the individual at all levels. What is the family history? What's the lifestyle of the individual? What are all of the biomarkers combined? And then you have to approach every individual accordingly. I always think about the fact that diabetes is considered a risk equivalent for coronary artery disease. So if I reverse my diabetes and I'm no longer diabetic, but I have the uptick of ApoB, it's probably worth a little bit of that uptick of ApoB because I'm now no longer diabetic. It's a complex problem, and it requires a kind of a physician or a healthcare provider who's willing to look at it at that multifaceted layer and not just as it in a silo. I do think there's just so many contributing factors to why one person develops heart disease and another person doesn't. It is not just LDL or ApoB, but does that contribute to a lot of people? Absolutely. At the same time, 50% of people who have heart attacks have normal lipid levels. So we know right then and there that cholesterol is not the primary sole player in the process. But I can't also, ignore the lipid levels. I can't ignore it, but it's part of the decision tree. I hope that helps.
In ordering a lot of the other biomarkers that you discussed about HSCRP and fasting insulin, all the other factors that you brought up.
I
right,
get
and
that.
that's why too, I think looking at the fractionation, the lipoprotein fractionation is really helpful too. Looking at that particle size and pattern, it is really important though to make sure that if you do the fractionation, you're comparing one lab to same lab as opposed to, because there's different methodologies to determining that. There's so many moving parts, so many components to that puzzle. But if you're improving multiple biomarkers at the expense of an uptick in the ApoB, it's probably worth it.
Yeah, Dom, were you going to say something? Sorry, I was going to chime in.
Oh, well, yeah, I guess, that was a perfect answer to a question that I get all the time. And then the next question people will ask, well, should I use a pharmacological agent? Everything's going in the right direction. My ApoB is elevated. Should I just use a small dose of a pharmacological agent, a statin, to bring that back down? So everything looks great. So I don't think, unless there's a family history, like you said, it doesn't seem to make sense. But it's also important to acknowledge that we do not know what an elevation of ApoB means in the context of someone who's, been doing sustained nutritional ketosis for a long time. We don't know that. And then, that phenotype is called the lean mass hyperresponder. And we just submitted an editorial with Ron Krauss was the senior author who developed a lot of the methodology for the lipid monitoring. And we just don't know that answer. I think we need more research. But I think it would emerge out of the epilepsy studies where you have, 80–90% of the diet being ketosis, that people would have significant atherogenic effects from following such an extreme diet. in these populations, and that data has not emerged in that context, really.
And I'll oftentimes do a coronary calcium score in patients, which is going to give us a little bit more insight. So if I'm on the fence with somebody, they have adopted a low carb or ketogenic diet, there's been multiple biomarkers that have improved, but there has been an uptick in the ApoB, especially if there's like a family history. I will do a coronary calcium score. It's not a perfect test. It is a screening tool. However, it does guide me. If they have a high calcium score, I'm going to act differently than somebody with a 0 calcium score. So I think just the more information we can get to make the most informed decision possible for the individual is key.
Yeah.
And by the way, a calcium score is like $150, $200. Like it's actually pretty affordable.
Yeah. I was just going to throw in sort of more anecdotally on myself. I'm one of those lean mass hyper responders. When I first started the diet 6, 7 years or however many years ago now it was, my LDL was off the charts. LDLP, I mean, you know, I was hypersynthesizing, absorbing cholesterol for whatever reason, and did a little self-experiment where for 60 days went on a lower saturated, higher monounsaturated ketogenic diet. Saw a big shift. So for whatever reason, for me personally, saturated fat does cause this overproduction of cholesterol and what have you. But to Allison's point, I've done a calcium screening, I've done a cardiac CT, you name it, and everything looks great, even, you know, 6, 7 years later. But the biggest thing for me was that risk, you know, reward benefit of all my other markers, my C-reactive protein, my blood sugar stabilization. I'm no longer hangry all the time. Things along those lines, like feeling good and energetic and cognitively optimized was so worth it to me personally, and everybody's risk tolerance is different, you know, that I continued on with the diet, because for me, the numbers that I was seeing otherwise, you know, markers of health were all improving. But, you know, there is a lot of unknowns, you know, when we may find down the line, maybe that wasn't a good decision for me. So I don't, you know, because I do have a bit of a family history. So those are things to definitely take into consideration and work with your doctor on.
And I will say from the fat perspective, definitely reducing the dairy fat. I find that to be the most effective mechanism to stay in ketosis, but not have your LDL ApoB go sky high, is reducing the dairy fat. And unfortunately, that's a knee-jerk reaction for a lot of people adopting low carb and ketogenic nutrition, is like, I'm just gonna eat cheese and whipping cream, and you know, and so when I say, okay, now let's remove that, use it as a garnish. Let's get our sardines, let's get our monounsaturated with our olive oil and avocado, nuts and seeds. It is a dramatic shift that I see the LDL ApoB go down. So
Mediterranean ketogenic diets where it's at for me these days. Yeah. So yeah.
All right, on the heels of what Victoria just said, and because we keep bringing up sardines, I want to bring up diet in general for a couple of reasons. So we know that the underlying current of this masterclass was that of ketosis and the ketogenic diet, but we know that ketogenic diets can be hard. They're restrictive. They're not for everyone. Michael had on his slide that N of 1. Everyone's different. People react differently. There are the diet wars. I looked at Michael's slide deck with that diet war slide, but I just want to throw this out because Dom, you had a slide within your presentation talking not only about strict ketogenic diets, but even things like the modified Atkins diet, the low glycemic index diet, and the fact that some of these still can confer some of those same metabolic health benefits, though not be strict ketosis. And we actually even had an email come in talking about some of the research around longevity and things like legumes and grains and plant-based diets. So there's a lot of diet stuff out there. And it feels like the undercurrent of this masterclass is the ketogenic diet, but it's not. I heard Mediterranean diet. I heard Dom talk about these other diets. So how do we cut through this noise? And if we're looking for metabolic health, does metabolic health equal ketosis necessarily? And can't other diets profoundly contribute to metabolic health? So I'm just going to open that up. Just as a general, everyone, you know, give your thoughts. The ongoing joke on our podcast with Michael is that we go through all of these experts and then people say, okay, great, what am I supposed to eat now? And we're like, well, it depends. But so I'm just going to open that up as a controversial, not anti-ketosis, just as like, okay, ketosis is a great tool, but help us cut through that noise.
I'll jump in if that's okay. So, you know, what I really preach at the end of the day, you heard me say, eat food you grow, hunt and fish. If our society got rid of ultra processed foods, sugar, what a different world we would be in. Okay. So but why I feel carbohydrate restriction and ketogenic nutrition is a great tool or bridge to get to that place is because of the cravings and the food addictions and our relationships with food. And it's funny, there's all sorts of different camps, right? Like, oh, you're too restrictive if you're telling them not to eat any carbohydrates. But guess what? I have a lot of patients, the only way they can bridge the gap to that place of eating real food, we grow, hunt, and fish, is by 100% removing it from their diet. So this is where it becomes very personal to the individual. Like if you are someone who does a lot better with complete restriction, great. If you're someone who feels like I'm gonna cut my right hand off if you tell me never to eat a piece of rice again, then maybe that's not the methodology for you. But at the end of the day, if all of us just ate real food, what a glorious place that would be. The problem is we are just inundated, right, with the opposite, and it's hard to live in our society unless you kind of declare a certain path and way of living to kind of stay in that bubble. I'm going to shut up now.
Love that, Allison.
I was just going to say the same thing. Real food, I think, is like the foundation, you know, staying on the outer aisle of the grocery store when you shop with the produce and the meats and, you know, all of those things. Because at the end of the day, I mean, you know, for me, I cycle through with periods of ketosis through food, to nutritional ketosis, but also fasting. But then I gravitate also towards a more paleo kind of approach with some complex carbs in the mix from time to time. I think metabolic flexibility is a great thing. And, you know, as you, depending on the person, of course, as you transition on to maybe a lower carb diet, I think it can be good, even healthy, to shift your sources of carbohydrates from time to time. But at the end of the day, like really focusing on what Allison was saying, real food, eating real food, is just going to make a huge difference for people. And honestly, that's why we called the conference Metabolic Health Summit and not, you know, some nutrition approach, because we're going to go where the science goes. So if we're, you know, if bananas are a great thing down the line, we're going to go where the science goes. But, you know, I think, and that's going to continue to evolve. You know, the research is showing incredible things in a variety of applications when it comes to low carb ketogenic nutrition in a variety of different ailments, from brain health, neurological health to cancer, you name it. But it's not a one size fits all approach for everybody. But eating real whole foods definitely is. So I think that's where the focus should be, personally.
Yeah, and I'll be the first to say that someone could have amazing, even perfect metabolic, cardiometabolic biomarkers following a high carbohydrate diet. Mm-hmm. And, you know, I think the most important biomarker maybe we didn't discuss is just simply body composition. If you have someone who has, you know, a lean, and they're muscular, they're lean, they're athletic, and, you know, they're consuming lots of carbohydrates. Although we did recently publish a study with colleagues showing that if they wear a continuous glucose monitor, their glucose trended to be borderline pre-diabetic, or just pre-diabetic. And these were, you know, athletes that did it in a crossover design, did high carb versus low carb. But I think when we talk about the ideal diets, I'll just echo the sentiments of Allison and Victoria, that a lower to moderate carb Mediterranean-like diet, whatever, the Mediterranean diet always confused me because it's not like really defined. Sometimes it has pasta and whole grains and things like that. But I think just low to moderate carbohydrate diet of whole foods is really where it's at. And, you know, for some people, it's important to acknowledge that we studied the ketogenic diet because our primary research was in seizures, and that's how it evolved. And then we just started looking at emerging applications of it. But I think any diet followed not in excess with the moderate calories and whole foods can optimize, you know, metabolic biomarkers. And then there is an additional benefit to elevating and sustaining your ketone levels. And then beta hydroxybutyrate has some very interesting effects, not only on the brain, but on systemic inflammation, on blood flow, a number of different things, epigenetic effects that we're studying in the lab. So perhaps the ideal diet is a lower carb Mediterranean diet, rich in vegetables and maybe some fruits, and then with, you know, elevating ketones. And that could be with MCT oil, which is a great way to, it's kind of like the poor man's ketone ester, and that can be incorporated into salad dressings along with, you know, extra virgin olive oil, and added to salads and vegetables, which enhances the absorption of fat soluble vitamins and things like that. So I think that needs to be appreciated. But We do talk, which seems disproportionately high on ketogenic therapies because that's kind of the cornerstone of our research program.
Love it. Michael, where do you land in this diet fight?
Oh, I'm so appreciative of this group and how amazing everyone is, because I feel like we've captured so many important elements to answer that question. Like with Allison saying, basically, you know, we see so many different people that we're working with so many different people, and in some people you're going to be making very minor lifestyle changes, and then in other people you're going to be helping them to understand that maybe being so strenuous with that particular dietary strategy is not in their best interest long term. And so when it comes to just overall prevention, it's fascinating to me. We've talked about, you know, pediatric health, we've talked about cancer, and at the core of these things, metabolic health is one of the greatest preventatives of chronic disease, right? But yet we're constantly inundated with so many things that are trying to work against our own. I'm just thinking about my own kids, and like they go to the library and all of a sudden they're coming home with candy. I'm like, what are we, what? You know what I mean?
Everywhere.
It's so hard. It is so hard to get this going. And so for some people, you know, it's just going to be those first steps, like we talked about at the beginning, to just get them understanding this a little bit more, and then we're working them down that path towards wellness. And then in other people, we might be focusing on something completely different because they get that part of it. And so, you know, again, I think we're constantly conjuring or putting this information together, but then we're also saying, okay, let's make sure that that's in balance with all the other important things in your life that drive health, whether that's purpose, whether that's sleep, whether that's, you know, all these other things, because sometimes the diet is going to be the key to their wellness, and then sometimes it's going to be something else that is also, you know, what is making it all worth it, I guess.
Yeah.
I love that. And Michael can attest that I've basically been in ketosis most of my adult life and did great with it. But then I became a middle-aged female, hormones started to get crazy, and I developed profound insomnia. And so I came in one day, I said, Michael, I'm eating potatoes. I'm over it. I mean, and it has changed my life, like seriously. So I hear you that it's not a one size fits all. It's different for everyone. And it's just the whole concept of, you know, you don't have to be in freight ketosis to have metabolic health. It's a great tool. I think Allison said it very well. You're not growing Pop-Tarts, so let's eat real food. Let's all get on the same page. And it's a great message, and I love it. But I know how important all of that ketogenic research is to put out in the world for brain health and for metabolic health. So I also appreciate that. I also want to thank you all, not only for an amazing virtual masterclass this week, but for joining us and letting us ask all of your questions. I've hit many of the themes here in the chat, amazingly, I think. These will be available. Caitlin will email all of the videos out to all of the registrants and attendees. They'll be available in the Facebook private Metabolic Health Revolution chat room there as well. They will live there. I also want to remind everyone, again, if you are a consumer and you want to go to check out the Metabolomics Plus test, you can go and use the promo code MHRMM $50 for $50 off. There's also a promo code for the Metabolic Health Summit. I'm going to kick that to Victoria and or Dom if you want to promo that.
Oh yeah, well I will. I think it's Genova 50. Well, you might have. Genova. I'm like, what was the code that I created? Genova 24. You can get $50 off. Metabolic Health Summit 2024, that's going to be in Clearwater Beach, Florida. We're so excited. January 25th through the 28th. Genova's going to be there as our amazing partners again. We're so excited, and thank you guys for, you know, the biggest thing here I think too is like trial and error for people and using lab testing as a tool to understand what's working for your body, right? Maybe not. So thank you guys for making that accessible, not just to clinicians, but also patients now too, so they can become empowered as well.
1000%. And again, these recordings were sent out by Caitlin, our amazing event specialist. I want to give a huge shout out to Caitlin Worley, who helped to put all this together and herd all the cats and have this to be an amazingly successful event. She did send out some of the links to the recordings. They live on YouTube. Anyone can access them. So don't feel like you've missed anything. I also want to put in a plug for the Metabolic Link podcast for further ongoing information. So subscribe, rate, review, share it with your friends. Quite similarly, the lab reports. And with that, I can't thank you enough all for being here, and hopefully this is the first of many to come.
Awesome. Thank you guys.
Yeah, we appreciate it.
Thanks everyone for watching.
Bye.